Hello everyone, can you hear me?
Yes, ma'am.
All of you can turn on your video first of all. So, this is a classroom. So, everyone should on their video. Okay. So, I'll introduce myself. Unfortunately, I can't on my video because I'm a little busy here. So, I just want to introduce myself and MindGuru to you. So, MindGuru is a sorry for that, I got a call. Okay. So MindGuru is a mental health institution in which we have 120 psychologists, and also we are providing all the psychological services. We're also conducting a lot of courses regarding psychology. So definitely it's a privilege to have you guys here. So I'm Shadia. I'm the Chief Social Officer and Consultant Psychologist and Psychotherapist of MindGuru. So definitely we'll be look forward more things with you. So today we are actually going to learn the dialectical behavior therapy. So definitely you know what is that, and you will be hearing that from a lot of years. So definitely today your class host, your teacher is Miss Kamalika Acharjee, and she is a very lovely and very humanistic psychologist, and she has a lot of years of experience. So I warmly welcome Miss Kamalika Acharjee to have the class. So thank you, Kamalika, for being here in a tough situation, and also she is our actually she is our senior member of MindGuru Psychological Counseling Services. So thank you, Kamalika, for being here. Thank you, everyone, for choosing us. So this is the beginning, just the beginning. So definitely we will be having a lot more things to do. So I'm signing off. Actually, I have a lot of work here. So thank you, everyone. Thank you, Kamalika. The stage is yours. Thank you.
Thank you, Sadia, for inviting me. And it is a wonderful class. I think lots of students already joined here. So welcome all of you. And first of all, Sadia already introduced me. And I am also giving a short intro about me. That is, I am a consultant psychologist from West Bengal, from Kolkata. And actually I'm holding double postgraduate degree, one from social science and others is psychology, and I'm a PhD scholar. Also, I have completed a diploma in counseling and guidance, and I have a certificate on stress management from IIT and lots of certificates regarding psychology. And I am practicing over 8 years. So try to convey some idea about DBT and to describe. This is an interactive class and long for 3 hours. So please be patient, keep your patience, and if you have any problem, just ask me. As just continue and give some break to recap the previous lecture. So in this way, we will continue whole the topics of today. So thank you all of you to joining here. First, I have just introduced one or two words. Everyone just start from Miss Dipti Srivastav. Just give me some intro about it. I know we are
Yes,
you are all psychologists, so I also opportunity to learn from you, and this is we are sharing our thoughts. Okay, so just introduce.
yeah, ma'am.
Yeah.
Myself, Dipti Srivastav. I am doing the psychology, master in psychology, and also have a diploma in guidance and counseling. Presently, I'm working in as a psychology counselor in Allen, Kota.
Okay, thank you. Next, anyone? Just yeah. Who introduce? Who will? Sri Lakshmi, Radhika. Just one or two words.
Yes, ma'am. I'm Sri Lakshmi. I did my MSc Counseling Psychology.
Yeah.
Now I am planning to joining a training in Child Development Center.
Okay. Next, Radhika.
Hello,
Hello.
My name is Radhika. I am also a campaigner of Sri Lakshmi. We together do the PG from the Kannur University, and I am also searching for a job, which is therapy. That is
So just a quick intro. Dipti, Dr.
Hi,
Hello.
this is Dr. V. Suryakumar. I'm an education psychologist. I completed my PhD in education.
Yeah.
This is you know some clarity. That's why I joined here. Thank you.
Thank you, Shalini, Shahana, Jinsa, I think.
Hi, ma'am.
Yeah.
Yeah, I'm Shalini. I'm a school counselor. I'm working in government higher secondary school. That's all, ma'am.
So, anyone?
Good evening, ma'am. I am Barkat Nisha from Coimbatore, Tamil Nadu. I am completed my MSW Medical and Psychiatric degree. Now I am starting own counseling center for Coimbatore city.
Okay, very good, very good.
Thank
All of you are so qualified and practicing already. So, any quick Anupama, Adila? That's it. I think that's it. It shows Redmi just here. What is her name? Please introduce. This name is not shown actually.
Hello, ma'am.
Yeah.
I am Hanana. I completed my MSc. Now I'm currently working as a consultant psychologist.
Okay. In first line. Anyone left? All of you. Many.
Hello, ma'am.
Yeah.
Myself, Suripriya VM.
Yeah.
I completed my post-graduation from Central University of Punjab in psychology.
Yeah. Thank you. Anyone left?
Hi, ma'am. I'm Shahana Basila. I just completed my post-graduation in psychology, and now I'm pursuing a diploma in child and adolescent counseling.
Okay. Just one name, that's Orijit
Hi,
Ghosh.
ma'am.
Yeah.
I'm Mehjabin. I have done my master's in applied psychology from Pondicherry University. I've
Yeah.
been working as an assistant professor in psychology here in Kerala.
Okay.
Yeah,
Very
thank
good.
you. That's
Hello, ma'am. My name is Zinat Nisha. I just completed in MA Psychology and currently working remedial trainer.
Wow. Very good.
Hi.
Anyone just yes.
My name is Adila Shihana. I'm from Kerala and I've done my MSc. Now I'm working as a college counselor.
Okay. Okay. I think no, anyone left? Orijit Ghosh. I think you.
Yes, ma'am.
Yeah.
This is Arjit. I am from Agartala, Tripura.
Okay.
Actually, I am doing MA in psychology, and I also done the child counseling courses also. Right now, actually, I'm interested for this therapy.
So mostly all of you from South, from Kerala, Tamil Nadu, right? Most of yeah.
So I am from Bengal basically.
Yeah, yeah, I know. Surname is shown this. You are from my state, that is Bengali,
Yes.
our regional language. So
Yes.
yeah, yeah. Okay, so I am just sharing my screen, and please help me to just tell me, am I clearly audible?
Yes.
Okay.
Yes,
And just confirm me whether you show me on my slides or not. Okay, just wait. Is it visible?
Yes, ma'am.
Yes,
Is it
ma'am.
visible? Okay, just wait.
Yes,
Just wait.
ma'am.
Yes, ma'am.
Okay, you see the full screen? Right?
Yes, ma'am.
Okay, okay. So we are starting this DBT, that is today's class, that is dialectical behavior therapy. First, I just want to know from you, have you any idea about DBT? Anyone? Anyone, just tell me. As you have, you are all psychologists and you have lots of experience, and then just I want to know from your side, have you any idea about DBT? Please carry on. If no problem, we are both side we are teaching and sharing, so I will also learn from you and you also from me. So just okay, then let's start. Today's actually lots of we have to cover. I have to cover lots of things. That is theory, that is techniques, and some worksheets, and I also I will also give you an assignment tomorrow. So just complete it and give it to me, return me. So this assignment actually, these are all our regular lifestyle, including our lifestyles, so on. So let's start. So we're just covering some topics. So just this is some contents. That is first, we are continuing about definition of DBT, how DBT was developed, who can benefit from DBT, CBT, you all know about CBT, I think, terms, CBT versus DBT, DBT techniques, stages of DBT techniques, benefits of DBT and DBT in various settings, and we will learn this therapy with some practical worksheet and practical. This is a practical class, that is we cover this with this theory. You can note down some important points from my slide also. So I was going to start the next slide. That is from definition. Okay. So actually, DBT, we know the full term, that is DBT stands for dialectical behavior therapy. So it is a structural program of psychotherapy with a strong educational component, which actually designed to help individual to develop their skills. What skill? So to manage their intense emotions and negotiating social relationships. Actually, DBT's main goal is to manage emotion and negotiating social relationships. This is the difference from others therapy. This. So kindly note it about this. It is managing intense emotions and negotiating social relationships. So we know that is DBT, that's full form D, which means dialectical. We know what is the dialectical meaning. Dialectical means when the two opposite conflicting force actually can go simultaneously, which can be true, both which are true. So we can say it is dialectical. And B and D means in DBT, that is behavioral therapy, which means that DBT aims to adjust this behavior. Actually, when this two opposite conflicts are joining simultaneously, then it is some confusing that how this therapy actually works. So DBT works in this area to manage this emotions and manage this behavior and adjust this behavior by some techniques, through some techniques. So okay, so next is which I just called earlier, this earliest slide, that is the main principle is DBT is from the word, it comes from word dialectical, which describes the tension between two opposite forces that are both true at the same time. And in this case, in this DBT, actually in this psychological term DBT, this dialectical refers that the concept of acceptance and change. When we have the intense emotion, so we can't accept this, we can't manage this. So the main goal is DBT is to concept this the acceptance and change your behavior accordingly. Have you got it? Have you got it, that points, definition? Any problem? Just give me some feedback, okay? If you have any problem, just speak and tell me. So the clients, when we deal the clients who their focus, so changing what is possible, what is acceptable, and what cannot be changed. So just think some of incident or event we can change, we can accept it. It's not we have to accept this. We can't change this situation. In that case, we accept this, but we feel stressed. So we have to manage this situation by this therapy, that's the DBT. And some event, some situation we cannot change. So we also accept this, that this situation we can't, this situation cannot be changed. So we have to accept and we have to change our behavior according accordingly. So the therapist duty or therapist main motto is to determine which of these two options is healthiest, either first or second one. So this is mainly our goal. You are going to use this therapy with your clients. So your main goal should be to guidance them and determine which of these two options is healthiest. Okay.
Ma'am,
Yeah.
this therapy is focusing to give insight for a change.
Yeah. Yeah. By this, through this technique.
Okay, ma'am. Okay.
Okay. So DBT actually, these dialectical strategies to DBT help the individual, help the client to get that unstuck position, to get unstuck from extreme positions and balance the viewpoint, that is which one this opposite, that's conflict points. So balance these viewpoints and view the situations from multiple perspectives. You know, from when we give therapy of CBT, we also see that from multiple perspectives. DBT also same. We view this situation from multiple perspectives to reach a logical viewpoint to the client. So DBT help individual and get out individuals from this unstuck position and balance out these viewpoints and view the situation from multiple and various perspectives to reach the logical viewpoint that he or she can adjust their behaviors and or change their behaviors according to this viewpoint. So during these sessions, the DBT therapists learn to first, just you have told earlier, just learn to assess the situation first. When your clients come to you, just you assess the situations and the target behavior that are relevant to clients' goals in order to figure out how to solve problems in their lives by adjusting their behaviors. So first assess this and just chalk out his or her target behaviors. Then figure out his or her problems and adjusting their behaviors. Okay. So have you got it, the definition? Have you got it, the definition? Clear? Clear, all of you?
Yes, ma'am.
Okay. So then first we have to know the background of this DBT therapy, how it was developed. So DBT, which is the therapeutic approach developed by psychologist Marsha M. Linehan in 1980. Actually, it was developed for the mental health disorder, that is BPD. We know everybody, that is borderline personality disorder. And so originally it was designed for them. And some condition we have already know that what is the symptoms of the BPD, that is they have an unstable sense of self. So they have low confidence level, so they are not in stable conditions. So they have intense emotions, so much impulsive and their this impulsive their feelings already also expressed through their actions. And they have the relationship difficulties, relationship problems, and they are thinking black and white, which means extreme, either extreme positive or extreme negative. Okay, this is called black and white thinking. Either everything is right, not everything is wrong. it is not possible for me to do this, so and so on. So these are the symptoms the BPD patient suffers. So originally this DBT developed for them. Finally, slowly, also the psychologists see that any others behavior mental health problems also in this problem DBT also works. We are going to coming slides about this, how it is helpful to others mental health conditions also. So next is how it is
Ma'am,
just yes.
Can you please explain once again the black and white thinking?
Okay, that's black and white thinking means someone who just thinks everything extreme. Is positive is extreme and negative is extreme. If something he or she just thought that it is fully acceptable for me, or it is very much right, and simultaneously she also think that it is impossible for me. It is negative also extreme, and it is positive also extreme. Not middle. It doesn't exist in middle stage. All this either extreme this point positive side or extreme this point negative side. Either happiest person or saddest person. Have you got it? Understand? Okay.
Yes,
So,
ma'am.
so it was found that how effective is DBT addressing others' mental health conditions also. That is ADHD, eating disorders, generalized anxiety disorder, all the common to you, I think, and that is GAD, that is OCD, obsessive compulsive disorder, or major depressive disorder, post-traumatic stress disorder, substance use disorder, suicidal behavior. All these are these mental health conditions, and DBT. It is found that DBT also works with this mental health conditions also. We are going to this next slides also to just discuss about this some problems and how DBT can effective these problems. We have discussed. We should discuss next slide. So next is other this mental health condition, normal people who can benefit from DBT. Me, like me, you, all the individuals, how they can benefit from DBT. So sometimes we are going all this phase. That is, the persons sometimes have a hard time dealing with our emotions, some negative phase, or sometimes we are also going some bad phase, or so we are excited, some extreme intense emotion also. All we have faced this problem. So the person have a hard time dealing with the emotions. Their emotions are intense or explosive. Sometimes they regularly experience mood ups and downs. Their relationships feel sometimes like a roller coaster, like ups and relationship. In this relationship also, sometimes they go up and downs, and it is always this goes on, and we are already faced sometimes in our in everyday our lifestyles. So it is also a problem. Sometimes we feel empty or hopefulness for time being when we have faced any problem. we feel empty or hopeless or sadness. Sometimes they have tried other therapies that have not work, others like CBT or others therapy you have already tried many of therapy like REBT or ABA or others, art therapy, music therapy, any other gesture therapy. So sometimes when the other therapies have not worked, in that case DBT can helpful in these situations. So their life feels out of control or isn't fulfilling. They're using outlet to cope with stress or overwhelming well-being. So emotions that could pose health risks, life substance, or unprotected sex. So is that these are all these some others problems other than mental health problems. So the DBT can also helpful in these situations also. Okay. So now we just find the difference between what is CBT and what is DBT and what is the difference between these two. So actually DBT is based on cognitive behavioral therapy, that is CBT, because it is also change our behavior, also change your thought, and we also see the situation from multiple viewpoints, multiple perspectives. So it is actually emerged from CBT, but the difference between these two, that is DBT particular works on emotions and handling that emotions, and that is a balance between acceptance and change. So so we can say it is the modified version of CBT. While the CBT focuses on our negative thought and turn into it in positive, our feelings and behavior influence with each other, but DBT emphasizes more on regulating our emotions and being mindful and learning to accept that pain and accordingly change that behavior. Okay. So it is a difference between CBT and DBT. I think all of you uses CBT, right? In your to your client and or other therapies, right? So just sometimes give answer. So otherwise, I think I from one side I will I am
ഇതുവരെ ലോഡായിട്ടില്ല സ്റ്റോറി ഇടാനായിട്ട്.
Okay. Okay. Please mute yourself. Someone, I think Jinsia, I think. Just mute yourself. Yeah. Thank you. Yes. So now till we are learning about what is DBT, what is the DBT's definition, how it is helpful in general, and who are most benefited through with this DBT therapy. So now come to the main topics, that is techniques, actually which we have to apply to your client. So DBT techniques, we know that DBT has evolved to become an evidence-based psychotherapy approach. So its main goals are to teach people how to live in the moment. It is the main how to live in the present moment, to ignore your past, and so how to live in the present, develop healthy ways to cope with stress. We know that today's life, all we are in stress position, from the kids and to adults and the old person, all we are going to stress, facing stress in our lifestyle. So through DBT we can learn how to cope through this DBT technique with stress. So we can manage our stress through these techniques. So first one is how to live in the present moment. Second one is develop healthy ways to cope with stress. Third one is regulate emotions. And fourth one is improve the relationship with others. So this is the main four goal of this DBT techniques, through which we can managing our intense emotion and maintain our social relationship. This 4 point is very important, and we are going to learn how this point we will discuss more broadly in coming slides. So these are the main goals of DBT techniques.
Ma'am?
Yeah, yes.
So it is a concern with mindfulness. DBT is a concern with mindfulness.
Yeah. Just be patient. I just go for next slide. Okay. So just the 4 techniques, 4 key components and techniques we used in DBT. First one is mindfulness. That is just you have told me, that is stay in present. How to stay in present? That is we learn this from this mindfulness techniques. Second one, how to manage the stress when we are in distress. So we have to manage some stress management techniques, and we have to improve our tolerance level and our distress level. So this is the second technique, that is distress tolerance. And third one is emotion regulation. That is how to regulate your intense emotion. That is emotion regulation. And the fourth technique is interpersonal effectiveness, through which we can maintain our social relationship, the relationship between with our family members, our friends and others, and we can socialize through this interpersonal effectiveness. How the way we can talk with other one, and how can maintain how should we maintain this relationship. So this technique is called interpersonal effectiveness. So these are the 4 key components and techniques of DBT. Slowly we are going to develop this techniques, and how it is helpful to others, our system and others conditions, situations is also. So it is our main DBT's main goals. Actually, we know this DBT actually developed for the mental disorder of borderline personality disorder in mind, but it has also been found effective in addressing other mental health disorders. I just call my previous slide this other some mental health conditions. So now I'm telling how this DBT techniques can help these mental health conditions. So first of all, that is ADHD. All of you know everything about ADHD. Just ADHD, the full form is attention deficit hyperactivity disorder. So we know it is a most common neurodevelopment disorders, which actually emerges from childhood, and it is first diagnosed in childhood, and it's lasts till adulthood. If it is untreated, then the person face loss of problem in his adulthood also. So can anyone tell me about the symptoms of ADHD? Just one or two just symptoms. Have you any idea? All your psychologists, I know all you have surely know about it. What
Hyperactivity.
Yeah.
Impulsivity.
That is actually how they do, how the children do this, how they face trouble, face difficulties.
They cannot sit in a place, or they will be walk around and around like that.
Yeah. Can you deal any ADHD patients? Anyone?
Yes, ma'am.
Okay. So is this you treated them or this patient? How is your experience? What is your experience about this?
Actually, they have no sitting tolerance, then lack of attention.
Yes. And how the response? How he responds? How the child responds in your treatment?
It will take 1 or 2 weeks to make them able to sit in a place.
Okay.
Then gradually they adjust to the situations.
Okay. So actually, so the children with ADHD may have trouble paying attention, controlling their impulsive behaviors, their emotions, or be they're overly active, so much active. Say may act without thinking about what the result will be. It behave with so whimsically, so they can't think what is actually what will be the result. So that is the main symptoms of this. But in this, some of the ways these DBT skills help these people first to regulate their emotions, including their inhibitive behaviors, their impulsivity, by regulate their emotions, and refocusing their attention through self-soothing and distracting skills, which we'll learn with our next slide. That is what is self-soothing and what is distracting skills. So DBT helps to refocus their attention gradually, and deciding on the value-based action to help solve the problems with assertive way, or managing the emotion effectively with other ways through acceptance. So in this way, DBT skills help people to learn the tolerate the moment to their internal experiences such as emotions and physical sensation also, like agitation, anger, or restlessness. So they manage their feedback or interrupt, manage their feedback or also interrupt others. So by learning this this tolerant techniques, these uncomfortable experience, they can get out from these situations, and they can change their behaviors through this DBT skills. So this all about ADHD, how the DBT help in ADHD. Next one is eating disorder. You know, there's what are the some eating disorder types, that is anorexia nervosa, binge eating disorder, and bulimia nervosa. Have you any idea about these eating disorders? Anyone? Anyone about this eating disorders?
Binge eating means
They will,
people eat so much in a one time.
and
And
after that,
they will eat the food in a one.
yeah, after that they try to rid themselves by purging this food. So actually, eating disorder cover a variety of condition, which will main problem is irregularities in eating habits. So main occur due to irregularities in their eating habits. Mostly, you just see that mostly the young generations, they try to maintain their health and maintain their figure, their body shape. So sometimes they face these problems, eating disorders. So it's an intense preoccupation with one's body image or shape. So I just tell about some this type. That is first one, that is anorexia nervosa. That is the actually it is the eating disorder. That is the person when it's an intense fear about gaining weight, and so that he or she can restrict her food and or over exercise to manage this fear. So it is a mental health condition. To overcome this fear, DBT can help her. And next one is binge eating. That is when the patient eats a large amount in a short period of time. And last one, this she told about, that is bulimia nervosa. That is individuals when eat a large quantity, then try to rid themselves. If he just has some guilty feeling, and they can read all this and themselves by this food, or purging themselves this food. So this is the eating disorder, and in this case DBT also help them to overcome this fear. And because sometimes they feel the insecurity problem, which affects their in future, or and also it affects their behavior towards eating and food. So in this way DBT helps this in this disorder. Next one is GAD, that is generalized anxiety disorder. We know that what is GAD? That is a types of generalized anxiety disorder. So have you any idea about GAD? Have you any idea? Anyone? Have you any idea? So GAD is a long-term condition that causes a person to feel anxious about a wide range of situations and issues. Actually, the person who suffers from GAD, or generalized anxiety disorder, they are not anxious about one specific or particular event. They feel anxious about a wide range of situations, anything, any small and big situation, anything that he or she can anxious about that. So it is an anxiety disorder, and the symptom is often mistaken for everyday stress or written off as worrying too much. And if there, it depends their how their body responds to increased level of certain chemicals. Like sometimes panic attacks can appear this from this guy, and somebody thinks that I have a heart attack or like this problem, physical ailment, but it is not so that actually it is a anxiety disorder, and it is a generalized anxiety disorder. So it is a broad spectrum of conditions that fall under this anxiety. Mostly it's an unmanaged emotion as a primary trigger for adverse reactions. So this is particularly true that some persons have specific phobias, panic attacks, avoidant personality disorder, and social anxiety. And but these conditions actually dominated by the emotion or fear. So we can see that as DBTs regulate the emotions, so already it is declared that DBT surely helpful in these situations. So they can overcome these negative effects. And in this case, so DBT plays a significant role, not only the identifying the emotions, but also figuring out the best coping strategy to manage this. Okay. So next one is major depressive disorder. That is chronic depression or major depression. We know about depression is a common mental disorder, which we can also call this a mood disorder, which involves persistent feelings of sadness, hopefulness, and loss of interest in which someone previously actually, which is enjoyable for them, but when he or she goes this condition, so they lost this their interest activity, so they can feel hopeless, sadness. So actually it also sometimes it can also cause difficulty with thinking, their memory, their eating, and also sleeping. So but recent studies have shown that the DBT is very much effective to this treatment of common symptom of this depressive disorder. So in this DBT actually focus in the teaching skill like this regulate emotions and managing the stress and improve the relationship. By using these skills, an individual with depression can better manage their symptoms and reduce the severity of their depression. So in this way, a patient can come out from the depression. Next one is OCD, that is obsessive compulsive disorder. We know that OCD is also a common chronic and long-lasting disorder in which a person has uncontrollable reoccurring thought that is called obsession. Sure, he wants to this any behavior repeatedly, and this is a staging over and over again. So people suffer from this OCD, repetitive words in their head and thinking, that is neutralizing thoughts to counter the obsessive thoughts, avoiding places and situations that could trigger obsessive. So in this disorder, DBT's the 4 techniques that we told earlier, that is distress tolerance, emotional regulation, interpersonal effectiveness, or mindfulness. These skills are used to either for example, the distress toleration skills. These skills are used to either destruct or self-soothe when faced with disturbing thoughts or emotions. And these skills can distract the person from this repetitive behavior. And emotion regulation, we know that's by learning this skills, they manage their anxiety to control their urge to repeat this behavior, and realize his anxiety also, and control their compulsion and reassurance. And their interpersonal effectiveness skills, they help to manage their feelings related to interactions with others. Sometimes the OCD patient cannot adjust their family members because their family members can't actually understand them. So it is also helpful for them to maintain this relationship if they can manage in their emotions. And last, that is mindfulness technique. This helps these patients to be more present at the moment, to avoid the past, and so being mindful, including not hanging on or not attaching the distressing thought, practicing being non-judgmental, and redirecting their thoughts to the present moment when they have some intrusive repetitive thoughts occurs. So this is a very effective therapy in this, for this disorder also. So next one is PTSD, that is post-traumatic stress disorder, which means that is it is a disorder. Actually, we know that trauma has a way of severely damaging the mind of a person. So PTSD can occur after experiencing or witnessing extreme trauma. It can cause nightmares, flashbacks, depression, and anxiety, among other debilitating long-term effects. And learning to process and deal with this past traumatic event can be life-changing. So it is a shocking and scary, and for some people who face this PTSD disorder, and it is natural to feel afraid during and after a traumatic situation. So we know that fear is a emotion that is a part of our bodies, and when fear occurs, we have a tendency to fight or flight response. Have you any idea this concept that is fight or flight response? Anyone? Have you any idea this concept? What is fight and flight response? Anyone?
Yes, ma'am.
Yes, just
it will
yes.
react. It will react to the situations. Either it will fight to the situation, or it will escape from the situation.
Yes.
That
yes.
is a fight or flight.
Yes. So normally when we are in stress situation, so it is if it is can solve, we have a solution, then, and if someone has the mental state that is he has strong strength and so sure he can fight with them. Others, when sometimes some problems we cannot change, that is we are told previous, we have to avoid this situation. So we can flight this we have our responses, that's flight response. We avoid this situation to avoid our stress. So this is called fight or flight response, actually which help us avoid or respond to potential danger. So when we are in threat, we give this response either in fight or flight. So in this post-traumatic PTSD, this always sometimes it is used, and DBT is regarded as an effective, promising type of treatment for those living with these challenging symptoms of PTSD. Actually, DBT for trauma focuses on helping the person to manage the emotions in the healthy way. They also learn how to nurture and navigate relationship that might be suffering from this aftermath of the trauma they have experienced. And this trauma treatment can help if someone had self-destructive behaviors that also interfere with someone's ability to function. So there are specific effective techniques uses this for this PTSD patients who faced an extreme trauma. So it is sometimes memories could be quite fearful, and the emotions that they trigger that causes a trouble, as this the persons sometimes they feel a great fear from great fear, so which is very hostile towards others, and they can be associated with this memory and sometimes cause the suicidal tendency, and so it is very much challenging is this disorder, and DBT can help this in this way. And next one is that is substance use disorder. Sometimes emotions are simply too much for some people, and they confront with these emotions. Some people look at the easiest way to way out to just give up their lives, and which could come in the form of either drugs or alcohol. So they depends on this drugs or alcohol, and they frequently use alcohol and recreational drugs, which can become a problematic situation occur. So it is a treatable mental disorder, which can affect if it is become problematic. It can affect person's brain and behavior also, so leading to their inability to control their use of substance. Sometimes it always sometimes faces some legal problem also. So they use the they have to use the medicines also. So it is very some people who face this or the substance abuse disorder, they have to control their emotions through this DBT technique. So next one is very important, that is suicidal behavior, which encompasses a spectrum of behavior that is some persons have suicidal ideation is defined as a pattern of thinking about planning one's own death by one's hand. So it is a process of thinking about considering or planning suicide. So it is there are some quite few mental health conditions that often push them this idea, and the best way to not feel the strong emotions to manage this, to cope up these situations, and the person then easy thinks that it is easier to give up his or her life. So it is they face actually extreme emotions of fears, extreme guilt, extreme insecurity or others feelings. That is so simply because this attractive idea, that is death. So in this effective treatment for people, DBT actually same way they can manage their and they help to stay on the present moment. They keep just to keep them keep away from the people from dying, and engaging keep out from them to engage in self harm, but also to help them to find deep seated meaning, that purpose to keep them alive and well long term. So, and to help them to life the life in healthy way to cope up this event and this situation. So it is also helpful, this technique also helpful to for this mental health conditions also. So in this way, this suicidal behavior, all these are mental health conditions. We had this DBT can help. So now we are come to some till this from this earlier side. Have you any questions or have you any problem to understand this these points? Or anyone have any feedback? Or have you got it? Have you got this? And how you feel about this through this slide? How it is the feedback about this class? Is it boring? Are you feel bored, or you can feel you feel interest?
Yes, ma'am. It is an interesting class and practical. बहुत very useful थे sentence या emotion जो आज मुझे पता लगा. You are comfort with Hindi, English?
Yeah. You carry on. I mean, just I have to. I want to ask you if you have. आप लोग को कोई हिंदी में अगर प्रॉब्लम है तो कभी-कभी मैं हिंदी वर्ड भी यूज कर सकती हूँ.
Yeah, ma'am. Actually, थोड़ा सा हिंदी.
Yeah. Have you understand हिंदी, और कभी-कभी मैं हिंदी भी यूज कर सकती हूँ.
Okay, मैम आपकी क्लास इज टू यूजफुल फॉर मी एंड मैंने बहुत सारी चीजें आपकी पॉइंट्स से ऑब्जर्व किया है एंड देन आई थिंक आई हैव सम केसेस ऑफ पोस्ट ट्रॉमेटिक स्ट्रोमा, सुसाइडल टेंडेंसी, ये रूट में मैं हैंडल कर रही हूँ. तो आई थिंक इज अ पॉजिटिव फीडबैक फ्रॉम माय साइड.
Thank you. Anyone? You can use Hindi also. मैं भी कभी-कभी हिंदी यूज करेंगे, हिंदू सेंटेंस बोलेंगे, क्योंकि ये इंटरेक्टिव सेशन है. सो डोंट हेजिटेट.
I like your session, ma'am, because when we study something, we don't know how to deal in some cases. You specifically tell that each disorder will be having this therapeutic effect. So this is quite interesting from the rest of the seminar which I were attended.
Okay, and we have to learn lots of things from this. So that is techniques. We are going to tell about the details of every technique and with practical skills, practical worksheet. So I think it is also helpful to you. बीच बीच में हम लोग ब्रेक लेंगे क्योंकि इसको अब से फीडबैक भी मुझे लेना है. And you also if you have any questions, you can ask me. So because it is a long hours, 3 hours class, so we have to बीच बीच में ब्रेक लेना ही होगा. and in this period we are interact ourselves, and you also give your idea, as you are all the psychologists and you have lots of experience as you have you deal the clients. So कभी कभी मुझे भी ये आपका experience बताना. So we are learn from this. So all we are psychologists, so all we have lots of experience with our clients. I think जब आप ये सब टेक्निक आप लोग को पता लगेगा तो और भी आप लोग अच्छा तरह से टाइम को डील कर सकते हैं. सो यू कैन शेयर विथ मी. ओके, योर अगर कोई स्पेशल कुछ और योर एक्सपीरियंस हो तो शेयर करना. हम लोग सब एक साथ है, सब लाइक अ फैमिली. ओके, सो जस्ट शेयर विथ मी. जब हम ब्रेक लेंगे तो ये जस्ट शेयरिंग प्रोसेस चलेगा. ओके, so the next one, that is DBT techniques. That is, देखिए just 4 techniques we just from this slide. That is mindfulness, that is distance tolerance, that is emotional regulation. You can just note down from this. Are you note down this from this slide? All of you note down?
Yes, madam.
Yes, ma'am. Okay. Yes. Okay. So actually, when I will give you the worksheet, these points there is not exist. So just worksheet, we will give you just worksheet. So you can miss this point. So you just try to note it down. So that is mindfulness, distance tolerance, that is emotional regulation, and interpersonal effectiveness. So mindfulness, that is, you just see, that is a therapeutic method that encourages you to focus on the present. We all know about mindfulness, but it is to stay in present. That is the first goal of the DBT technique. DBT skill to stay, how to stay in present. That is called mindfulness. Next one is, that is distance tolerance. That is a technique that uses distractions and self-soothing to cope. We will know about what is self-soothing after some times. So when some persons are in distress position or suffer some mental health condition, they have to distract from these situations. And how can they distract? With these techniques, that is distress tolerance. They have to tolerate these situations. They have to increase their distance tolerance level, and through this technique they can do this and cope with these situations. Next one is, that is emotional regulation. Being able to recognize, first you have to recognize your emotion, then level it and adjust these emotions. According to you adjust your behavior. So we know all these, our mental health condition all mostly comes from our emotions. And if we can regulate our emotions, we can manage most of our conditions. If someone is it's prevention stage or intervention stage, in earlier intervention, it is helpful. So they cannot it is not, they cannot go actually they can manage themselves also. They do not require to go to psychiatrist. They do not require to take medicine. If they can earlier intervention in this regulate their emotion. So first recognize their emotion, level it and adjust and accordingly adjust your behavior. So next one is that is interpersonal effectiveness, which is we have to improve your ability to communicate with others. Others means in socially, in family, in friends, in every situations. To improve the way of talking, the way of communicate. This is called interpersonal effectiveness. So first one is mindfulness. This is the logo of mindfulness, you see. So actually what is mindfulness we know. The mindfulness is actually the central component of DBT. It involves developing awareness of the present moment without judgment. Just live in present. Forget about your past or your future. Just live in present moment without judgment. Just ignore everything. And through this mindfulness practice, individuals learn to observe and accept their thoughts, their emotions, and sensations. It is by practice, obviously. In initial stages, still they have not, actually they are not concentrated, can concentrate, so their minds are wandering. So what is others says over here, sometimes others other sound over here, others some curse sound or anything else, or thinking about shopping, thinking about eating, thinking about our problems, so but this by practicing we can manage these thoughts, the emotions, and this sensation. So it is very important components on DBT, and allowing them to respond more effectively to difficult situations. Okay, so it is some points about mindfulness. So in this dialectical behavior therapy, we actually define that in this through mindfulness technique, actually we observing, describing, and participating in the moment, and as well as doing it non-judgmentally, doing one thing at a time and doing what works for you. So it is DBT's goal. And what is the result? These mindfulness skills help us slow down and focus on using healthy coping skills. When we are in midst of emotional pain, when we are going to this phase, so when our palpitation, where our heartbeat so increasing, and so we at that time we just practice breathing technique, some breathing technique, and control our breathing, and speed and slow down. So mindfulness skills, through mindfulness we can slow down and focus to this healthy coping skills. Next one is help to stay calm, shant rahiye. So देखिए, when we go this mindfulness technique, we just we talk ourselves, so just calm, peace, some words we just want to talk and say, to avoid engaging in automatic negative thought patterns, to stay calm. So mindfulness skills also help this way. Our impulsive behavior is also helpful, and sometimes gain a sense of control over their fear of the past or future. By practice, when we are focuses and when we stay calm, so we can control our emotions or control our impulsivity. So in this way, mindful skills help us, and this is a first skills of DBT. Through this some practice worksheet, we will discuss this all and broadly. So actually, this mindfulness technique is actually two types. Some types is formal, sometimes is informal. So देखिए first, that is what is formal mindfulness technique. Formal means that is mindfulness, that is meditation, which we just talk about with one next slide. First, we talk about this informal way, this informal mindfulness technique. That is mindfulness activity. कभी कभी होता है ना, हम कभी कुछ देखते हैं तो कुछ खाना या टीवी देखना, टीवी जैसे हम लोग तो देखते ही है इंटरेस्ट से और को माइंडफुली, पर कभी कोई काम हम लोग माइंडफुली नहीं करते, हम जा रहे हैं, कोई देख रहा है, सो हमारा माइंड दूसरी तरफ घूम रहा है. So this is a mindful activity that is informal. So every activity should do inform, should mindfully. Anything that if you can taste a coffee, subah ka chai, so you just taste it mindfully. If you touch somewhere, you just touch it mindfully. So this is actually mindful activity, and just one, yeah, this is. So that is some goal. First one is vision. That is sometimes it is an example. With by one example, we just describe this all this mindful activity technique. That is, first one is vision. So as we leave your home, you just notice, or if you go to your roof, you just notice the bright blue sky, right? You just when you leave your home, you just you just see trees, the streets, every empty streets, or the person's cars which are moving through the streets. So when we see the car, you just mindfully see this car, or you just notice one person, you just notice mindfully what is her dress, what is her actions, so on, so on. So just pay closer attention to your notice. So just closer your attention to the flowers along the sidewalk. Just see the street light, see the house, their colors, and every moment. जो कुछ देखना mindfully देखना. So it is our vision activity. Vision, mindful, that's informal activity. Vision activity. Next one is hearing. Sometimes हम लोग एक साथ बहुत सारे चीज सुनते हैं. So we hear lots of things. The cars horns of buses, horns of cars, horns of any noise of the ambulance and others. So each time this just hearing this noise, you are hearing this noise mindfully. Occasionally you hear sometimes you hear a car passing through us, जोर से एक हॉर्न बजते बजते चला गया. So just hear this horn. So hear the chirping noise of the birds. So hearing this. Next one is touch. You notice that warmth of sun, the hottest, the feelings of suns, the light of suns, so the and coolness of the breeze. With each state, you feel your foot landing. How should I, or how can I touch my first step to the road? Just feel our steps, feel our the relationship with foot and with our shoes. Just feel the touch. Touch your legs, touch your foot with shoes. Touch the feeling of road. So do it mindfully. And next one is taste. तो कभी कभी हम लोग टेस्ट लेते हैं बट अनमाइंडफुली लेते हैं. So just stop this. Pick up a cup, pick up a coffee cup, and then just taste the coffee, how it is. Is it too much sweet, or it is bitter, or I need some more milk or some sugar? So just taste this. Just taste, feel this moment when the your on this cup touch to your mouth, and you just first feelings of first sip, you just sip the coffee test. Just feel this test, or the feel any foods, any sweets, or any when we take our meals, just take it mindfully. How this today's meal, how this dal's test, how this cauliflower test, just how this our today's just preparation, how it is. Just taste it mindfully. Next one is smell. When the breeze floats by and we catch the smell of flowers and trees, as we continue our work, we notice the smell of freshly grass or flowers, or otherwise sometimes when we use perfume, just mindfully smell this, take the perfume smell. Is it good, or how it is, how I like this, or it is how it is, so it is very it is my favorite perfume. So just smell it mindfully. So all these are the informal mindful activity. So next one is mindful meditation. That is formal meditation. So mindfulness meditation creates awareness, identify our thoughts, our feelings, and physical sensation. So what are the steps of mindful meditation? The steps are: first, find a place free of too much noise or distraction to practice. When you give instruction, you will give instruction to your clients. So just maintain these steps. You can give them this, you can note down this point and give them this instruction written by written. So find a place free of too much noise or distraction to practice. Sit down on a cushion or the floor or in a chair. What is comfortable to you? Any comfortable position you can sit down. It is not any rigid instruction, but whatever comfortable to you, you can adapt this process. Turn your focus towards your breathing. Inhale, exhale. Notice the feeling of the breath. that entering your body and making its way to your lungs. It's cover your lungs and put one hand to your chest and other in to your stomach, and just notice how it is upward and downward, how it is expanding or it is just in this positions. So outward and inward position, just notice this with breathing technique. So just feel this breath. Next one is, as you practice, initially your mind will wander. Try not to judge and not feel guilty. So it is a judge, it is wondering, and how it is possible. I can't I can't manage this. I can't focus on this. But ignore this. Just leave it. Just leave it. Your mind will wander. You just leave it. The situation. Just ignore it. Try it, and not to judge your thoughts. Just like you just see this like the waves of the sea. Just is go on, just go out and go in. Just this like a wave. Not to judge his thoughts. So just होने दीजिए. चलो, चलता है, चलता है, चलता है. Just. So next one is, when the thought or feeling passes. If the thought or feeling passes, then again return your focus. If you feel that your mind will wander, mind is wandering, then again just conscious and return your focus to your breathing in your body. Again you start from beginning. Again you start with again keep your hand one in your chest and your stomach. Just notice your hand that is outward and inward. So just again focus on your breathing and your body movement. And try to practice for at least 10 to 15 minutes every day. And if you are more experienced, aim for 30 minutes. It is actually by practicing, it will happen. And choose your time. It is better if you choose that morning time, early morning and evening, or before going to bed. It is depends on the person which time is suitable for them, but it is the perfect time is early morning and going to before bed. इससे क्या होता है, स्लीप भी अच्छा होता है. हम लोग को स्लीप का डिस्टर्बेंस का मतलब अगर हम माइंडफुल मेडिटेशन करें सोने के आगे, सो जिसका स्लीपनेस का प्रॉब्लम है, इंसोमिया है, वो भी प्रॉब्लम से निकल सकता है, वो भी ओवरकम कर सकता है टू with this mindfulness meditation. So this is some tips about building mindfulness technique. शुरुआत just छोटे छोटे करके शुरुआत करना. So start small. First, not intend to, if you think that I have to do with 10 minutes, during 10 minutes and 15 minutes, you can't do it. So just start small. Just 5 minutes. If it is just possible, just start with 3 minutes. First start with 3 minutes mindfulness technique, meditation. Then slowly increase your time. So start small. पहले हम लोग को लंबा गोल लेके नहीं बैठना, धीरे धीरे हमको जाना चाहिए. So start small from 3 minutes to 5 minutes, then 10, then 15, so on. Practice out loud. That is first time initially. just try to speak with some mantra, sing just Om, just loudly, just Om, just this way. When we hear this Om sound, it is create your attention. So either you follow any music, meditation music, take your earphone, put it here and just hear this sound, or you can chant your own way. Any your pray any your God, any mantra, any means any Om chant. So start with this loudly. If we can do this, we cannot we avoid the distractions, the noise of surroundings. We cannot hear it, we can avoid it. We can focus on our breathing as this sound create our attention. So practice out loud, noticing your distraction. If you have any distraction, being also mindful about it. What is the distraction? So I should aware about this, and we have to avoid these distractions. Next time, we should not focus on this. We should avoid this distraction because we know this is my distraction. So if we're conscious about that, we surely avoid this. And don't judge your judging. Why I am saying this? So don't judge this. Go easy on yourself and don't cling to an outcome. Don't decide this. Is it how it is how it is happen? How it happens after this? So don't do this. Just don't think about result. Don't think about outcome. Just go easy on yourself. To start, you just abhi kaha, to start, you might choose to repeat a mantra. That is a word of your choice. Like you can choose peace, peace, or calm, calm, or any one, anything that is love, love. Just say it. So take it and so slowly, and something you can use as a anchor when your mind wanders, which is inevitably will. So this is some tips about mindfulness meditation. So now I'm coming the next technique, that is distress tolerance. With this logo, we just see that is a girl in his distress position, and this is when she tolerated this. This is a position. This is a mood, just so happy. So this component, everyone got it about mindfulness? Any doubt? Any doubt?
No, ma'am.
Okay. So next, this distress tolerance component focuses on helping.
Excuse me, ma'am.
Yeah. Yes.
Could you please show previous slides once again? Okay, ma'am. Thank you.
Okay. So this component focuses on helping individuals tolerate and cope with distressing situations without resorting to self-destruct behaviors. And DBT teaches several techniques about distress tolerance for handling crisis, including through this technique. First one is destruction. Second one is improving the moment. Third one that I said earlier, that is self-soothing. And fourth one is thinking of the pros and cons of not tolerating distress. All have some problems regarding tolerating issues. So what is the roots about it? What is the pros? What is the cons about it? About this distress? So we have to identify the distress situations, and this way they can tolerate this situation and increase their level of tolerance. And this distance tolerance techniques help prepare you for intense emotions and empower to cope with them with a more positive long-term look. And when we in our stress, when we learn about stress management technique, this techniques also, this distress tolerance DBT, is so much helpful to manage our stress in our everyday life. So it is very helpful technique, not only in mental health condition, but it is helpful for every one, for us. So just focus on this technique. Everyone, we can use this technique in our daily life. So this is the 4 technique. The distress tolerance practice, this is a worksheet. That is, first one is radical acceptance. What is this? Actually, radical acceptance is the healthier way of thinking during this situation. Sometimes when we are going to a stressful situation, so we think that is a black and white thinking. Just no, it is not possible for me to cope up with this. I can't overcome this situation. मुझसे ये नहीं होगा. So, but we have to accept. First, we have to accept to healthier way. And first, then how we can accept? First, we accept the problems. What is the problems in this route? What is our problems? Main karan kya hai isse? So how can we out of this? Is it in my control? Is it within my control, or is it controlled by others? So how can we overcome this, from this anxiety, this anger, anxieties when dealing with them? So radical acceptance means to cope with healthier way of thinking during this situation. For example, sometimes a person, if they were not selected for a job, they obviously they felt that typical thinking, no, it is not fair. I did everything that I have to. It is my cup of tea. Why others? It is something. It is some story behind it, or sometimes students, if their exam, if failed in exam, he or she can say, she said, normally the question is very tough, and teachers does not check the copy fairly, right? So it is very, very common for students, and also any individual. So I did everything right. So in these situations, radical experience teaches that yes, it is frustrating. I can't. I do not. I do not get this job, but I accept this because I think someone is better, would be better fit for this position, or I have some problem. So if we cannot think or we don't think like this way, we can't accept this. So this is the radical acceptance. So if a student think that no, I have not prepared, my preparation is not so good, so I failed in this exam. So it is helpful to him. He can more concentrate in future in their study, and in future they can pass the exam. So this is the radical acceptance. Accept this way, it is easier to cope up this distress tolerance, cope up this situation. Next one is self-soothe with sense. We just go through this earlier in our mindfulness technique also. It is same way, just repeat this also, that is find a pleasurable way to engage through our 5 sense of organs, that is our eye, ear, skin, our tongue and touch, our nose. So that is we engage our 5 organs through this vision, like go for a walk somewhere, or nice and pay attention to the sights. We can visualize through any our favorite video also, and visualize through this any situations, such if you can if you see any travel video, you can visualize, yes, I am also this go out for that place and visualize that's a sea or that's hill, and I just take him myself to that situation, to that position, to that place. So that is vision. Hearing, that is listen to something enjoyable, such as any music or any nature, any sound of nature, bird sound, or any sound of any falls, or like this, or any your favorite song, your favorite musician, favorite singer. So hearing, touch like a warm bath, or get message, or any touch, which touch you feel it is more, you can feel comfortable, any loved one's touch. So this is touch sense. Test, have a small treat, give yourself a treat. चलो आज कहाँ भी रेस्टोरेंट में खाना खाने जाती हूँ, so take a treat yourself. Not eat as a full meal, just treat something, just a, if it is a toffee, it is a chocolate, that's also fine. Just taste it. Smell, find some flowers or spray up your favorite perfume or cold cement. So this is, for this way you can soothing yourself through your sense organ. Okay, and this is the one acronym, that is accept. This is very important. What is accept? How we can destruct ourselves. Till now we have learned destruct cannot, just go for destruction, but how it is possible? So this acronym help us to destruct healthier way. Negative feelings will usually pass or last lessen on intensity over time. So we have to distract yourself until the emotion subsides. जब तक our intensity कम ना जाए, intensity can subside, we have to distract ourselves from these situations, from these feelings. How can we do this? Do that through this accepts. Reminder this idea. Accepts A for activities. That is, engage in activities that bring you pleasure, like exercise, watching funny video, watching TV, watching any movie, watching your pleasurable events, watching your pleasurable video, stand-up comedy, anything that, any activities, play games, go outside, and engage yourselves in with some sports, go to swimming, table tennis, anything, any activities. So engage yourself. That is first, that is A. Second is C, that is contributing. C for contributing. Do something kind for yourself or someone else. Volunteer, that is altruism. At a food bank or animal shelter or visit or any go work with any NGO. Any volunteering. That is called altruism. That is kindness. It is we feel a gratitude to contribute after this. So it is so much this kindness, this quality is so helpful, and it is a perfect way to happy ourselves. So contributing anything. Choices or comparison. Compare yourself to those less fortunate. Think yourself that I am so blessed. इस दुनिया में बहुत सारा ऐसा लोग होता है जिसका पास कोई अपॉर्चुनिटी नहीं आता, जिसके जो इतना डिस्टेंस कम पोजीशन में है, जिसके पास खाना नहीं है, जिसके पास पढ़ने के लिए कपड़ा ठीक ठाक नहीं है, छाद नहीं है माथा के ऊपर. So in our country, lots of people have already stay in this position. So compare yourselves how we are blessed. So if we think this way, it is also we can accept. We also accept we can increase our tolerance levels. Or think of a time of the past, in the past when you are happy. In this case, you think about past, your happiest moment or your challenging moment. How you have to overcome this situation. So if everyone praised you, that is your positive side. Your positive, you can achieve something. So think about this. Choices. Next one is accept. That is ACC. This one is E. That is emotions. Emotions. We know about what is emotions. Choose events that create different emotions that you are currently feeling. That is, just go for opposite. If you feel angry, just control your this aggressiveness by listening, music, and some management technique. When we actually this anger and management, I take class at anger management. We give some techniques about this. That is, go just counting 1 to 10 and others back counting. So control your anger, and and also or listen some soothing music. Just feel your current feelings. Just accept your current feelings. Identify your current feelings. If you're sad, then watch a comedy movie. Watch your stand-up comedy. Just give opposite actions to control this, to distract this. So next, as accept, that is P, that's pushing away. Put some distance between you and the situation. Push karo. Physically leave. Sometimes it is helpful for us if we can leave the place. Just take an example. Let's try it. If you're angry with to anyone, so if you leave the situation, your angry, aggressive, or your intensity of anger is down. So just walk away, review that situation, or block the thought by distracting this your mind for your needs. It is difficult, but try it. Thoughts. Keep your mind busy by engaging activities like this way, that is activities and activities. If you engage yourselves in activities, always you are focused on these activities, you automatically, your thought also engage in this. So that requires your concentration. And you can keep it this thought by counting, doing household chores. कभी-कभी देखिए अगर हम लोग कोई डिश अगर प्रिपेयर करते हैं तो उससे भी हम लोग का थॉट्स चेंज होता है. हम लोग एक्टिविटीज में उससे हैप्पीनेस आता है. चलो कुछ क्रिएटिव वर्क, डू सम क्रिएटिव वर्क, or completing a crossword puzzle, or any just sit with a color and then color pencil and then paper, just color it, any primary colors, any rich colors. Your thought automatically can be negative, or your thought distracted or automatically. So you focusing on this activities automatically, you can focus. So next one is sensation, that is accepts. Last one, that is say yes. Engage in activities that makes you feel present in your body, that is our mindfulness activity. So such as taking a hot or cold shower, giving a message, listening the recording of nature sound, that is, or watching a video, a relaxation technique, so on, so on. So in this way, others way we can improve our distress tolerance. That is, now till now we just practice the destruction, how to destruct the situation, and this way, this is the situation, how to improve the skill, how to improve our distress tolerance skill. The improve acronym outlines is also in this acronym we can tolerate this situation. First is imagery. Imagine and describe what it's like to be beautiful place. Just like you think I have a bird, just fly away, just go and like this that beautiful place. That is so much peace. So just imagine it. Next one, meaning. What is meaning? Describe the meaning you can find or create in your comfortable, uncomfortable situation. What is your uncomfortable situation? You just find it. You just identify it. If you identify the problem, you can sort it out easily. So that is meaning. Next one is prayer. That is describe, improve, that is I for imagery, M for meaning, P for prayer. Describe a prayer or meditation you can practice in this moment. You can pray to your God with any mantra, any chanting. That's we do it our mindfulness, formal mindfulness meditation. Practice this moment. That's prayer. Next one is relaxation. List a relaxation strategy and try such as breathing, deeply or listening. It is different types for every person. So list according to yourself, according to you. What are the things you like most? What are the things by doing this you feel relaxed? So list these activities, this strategy. So this is relaxation. One thing in the moment, that is for O. What is a simple but engaging activity? You can focus, not multitasking, just focusing one time in one moment. Just now you listening my lecture. I am just you giving you this presenting you the presentation, giving you this process, giving you the lecture. So this is one thing. I am just focusing on this. You are also focusing in this class. So it is one thing in a moment. This is one thing at a moment. Don't do multitasking. So it is in this way we can improve our distress tolerance skill. That is V, that is vacation. Least 2 ways you can take a break from your worries. Just for 2 days go for vacation. कभी-कभी हम जाते भी ऐसा. So just take a break from this. If you stress so much, if it is so bored, just take a break. So कभी-कभी हम लोग को क्लास से भी थोड़ा 1 minute 2 minutes break लेना चाहिए. So okay. So this is a vacation. Next one, encouragement. That is, select an affirmation, write it there, and then repeat it to yourself several times. If you feel some encouragement from yourself, find it some encouragement, any process or any way or any topics or any activities, just write it down there and repeat it several times. Repeat it several times. So this way we just complete our 2 techniques. First one is mindfulness. Second one is distress tolerance technique. Now,
ma'am.
Yes.
Can you explain meaning?
Meaning means just identify your uncomfortable situation, your problems. That is mean. What do you mean about it? That is meaning. What do you mean about your problem? What is your problem? What do you mean it? Okay.
Okay, ma'am.
Next verse is emotion. So just one word left, and we are in lots of topics. So just come बस थोड़ा सा जल्दी करते हैं. So that is, tell me what is emotion? Actually, emotion, we know everyone. Emotion is a most important common components of us. Emotion is a physical and psychological reaction that humans give in response to an event. Actually, it is a reaction. It can be different type. We know in every circumstances we express our emotions differently, and this is some emotions you just look this way. That is joy, anger, disgust, sadness, surprise, happiness, any like lots of emotions, guilt feeling. So these are the emotions we feel. We respond to different types against different type of activities. When you feel happy in one instance, we feel sad with other. It is normal. And these emotions are often confused with feelings and moods. Our moods can ups and downs with these emotions. And these emotions have three components actually. That's a subjective experience, such as how you feel internally. How you feel happy. If you feel happy, you express one way. If you feel sad, you can express other. A physiological experience, that is how you feel, how we express physically. When we feel anxious, happy, we feel hooray, just as we just throw out our hands and just our smile, big smile. So it is our physiological response. And if some you achieve, we just just feel got it as a type just physical response bhi hota hai. So and last one is a behavioral or expressive response, that how you show your emotions to others. Is it also same physiological? But sometimes when we for example, when we feel angry, we express that our feelings others, especially when to our loved one or nearest one. We talk so harshly, so badly to others, so negatively. So it is behind it's our emotions. That is, we anger, so we rude, we throw the different activities, like we throw our hands or break the any intestines or any flower vase or like any things in surroundings in our room. So it's a different type of expression of depends on person's tolerance level. So it is how you show your emotions, how it is how you depends your behavior, how you show your emotions through your behavior. So this is this three way. And so emotion regulation is immensely important, because we only control our emotions and our response to circumstances, not the circumstances themselves. We can control ourselves. We can't control others. So DBT help us to improve ourselves in the ability to understand and regulate our emotions. How it can help? Yes. So first is identify and labeling your emotions. First, you identify this is anger emotions or sad emotions or happy emotions, and labeling this intensity. Labeling this 1 to 10 point, 1 to 10 remark. Is it number 6 or it is 5 or 8? If it is 8, then we have to conscious. We have to down our tolerance, increase our tolerance levels. No, so control our emotions. We have to regulate our emotions. So it is identify and labeling first your emotions. It is do by written. How how can you give this number to yourself? 1 to 10. Mark it. Secondly, identify the obstacles to changing emotions. What are the obstacles? How can I change this? Is there any obstacles to change these emotions? Is there a problem in myself? So just identify also this. Reducing the vulnerability, because it is also it is negative effects in our physical and mental health and others also. So reducing vulnerability to emotion. Increasing positive emotion events. Go out for positive events. Increasing mindfulness to current emotions. stay in current events, taking the opposite actions. That is, if he is sad, listening the music, listening the comedy stand. So, if you feel anxious, listening the music. So, in this way, we can deal the emotions. So, practice. This is practice worksheet, that is doing opposite. Emotion, if we angry, fight, yell, and argue. Normally, we can do our actions is fight, yell. We yell and we argue. So it is angry. Do the opposite action, that is talk quietly, behave. This is too tough, but practice it. Talk quietly. Take deep breath and talk yourselves. Calm, pace, calm down, then talk quietly and behave politely. If emotion is sad, then withdraw your normally हम क्या करते हैं, withdraw from friends. कोई फ्रेंड्स के साथ हम लोगों का कोई कॉन्फ्लिक्ट हो जाए तो चलो बात नहीं करने की, बट डोंट डू दिस. विजिट to themselves and communicate with them. Communicate with others friends to go out from this, overcome this situation, sadness. Check the facts in the moment to help reduce the intensity of these extreme emotions. Ask yourself the following questions to check the facts. That is, what event triggered my emotion? What interpretations or assumptions am I making about the event? Is it right or is it wrong? Think about it. Take a break. Take a pause. Think about it. Does my emotion and its intensity match the facts of situation? Or does it just match is it overthinking by me? Is it assumption is right? Actually, is it we can ask this question in our CBT also. So just ask yourself the situations, check this facts. Then you have to control, you can control your emotion. Next is that, again, another acronym, that is please. Here, please, PL means treat physical illness. If you have any physical illness, just treat yourself. Go to doctor, take medicines, and just give from this, overcome this situation. That is, second is E, that is eat healthy. We all know about it, healthy food. So A is avoid mood altering drugs, which regulate our mood. So avoid it. S, that is sleep well. This is very important for every person. Sleep well. Most problem already solved if our sleep well. Sleep habit is well. So next one is exercise. E is exercise. Do it regularly. It increase our mood level. So this is emotion regulation worksheet. And some others, that is paying attention to positive emotion. Through this paying attention positive events, we can also control, regulate our emotion. What is this? Just see, we are the humans. Most people give more attention to negative things. If we have there is lots of, if you have 10 compliments and single one criticism, single one negative point, we probably focus on the criticism, not the compliments. We think about that criticism. we ignore that all these compliments. It is human nature. So, paying attention to positive events, not negative. If you notice yourself focusing on negative aspects, then stop it and refocus on the positive. Ignore it and refocus the positive. Practice by doing a small positive activity. Start again with small positive activity. That is, in everyday activity, we can acknowledge this, we can grasp these positive activities. So we can don't let minor problems, that's we can't cannot avoid the minor problems. So do it. And adding one or two positive activities, which is, but it is true that one or two positive activities can't change our life, but it is sometime for a fraction of moment, it help you to again to focus on your happiness, to gain up happiness within you. So some ideas, this is some quick ideas about how you can start your positive activities. That is, have a good unrushed meal, watch a movie, visit with friends and family and give adda, that's it. Visit a local attraction like a zoo or museum and anything, that's whatever you like. Go for a walk, simple walk, go for a walk mindfully, obviously. Put on headphones and do nothing but listen to music. Have a picnic or any day out. Give yourself a relaxing night in. Sleep over with friends. Try a new hobby. Learning something that this way you just learn some new things. In this way, try a new hobby or learning new things. So always increase your emotions level. So our next is, that is last technique, that is interpersonal effectiveness. So interpersonal effectiveness, as it is most basic, so it is the ability to interact with others. Actually, it includes a skill we used to attend to relationship, give the priorities, identify the priorities, balance the priorities versus demands. What are the priorities and what are the demands, and balancing it. So it is a very important skills to maintain our relationship issues. And interpersonal relationship skills are intended to help persons become more aware of how their behavior affects relationship and then make positive changes. So it is some body language when some interpersonal effectiveness, that is eye contact or gazing into the eyes, our emotion, attention, caring, affection. Through eye contact, our emotion is, we can give you attention, caring, and affection. So when we deal the clients, we should eye contact. We should build a eye contact with them, because we attentively hear their problems, and with our caring mind and affection. Smiling, talkative, clapping hands, singing, jumping up and down, or dancing, laughing, this type body language, which shows joy, excitement, happiness. Red flashes eye, face, neck, chains hands, pursed lips, crossed arms, etc. That shows our anger, dislikes, animals, aggression. Frowning, looking down or away, slumped postures, low, quiet, or monotone voice. It's noted the sadness, hurt, talking quietly and nervously, inability to sit still, shaking, pacing, speechless, crossed arms, frozen in place, sweating, shows our anxiety, nervousness, symptoms, fear, covering face, hiding, slumping, looking down or away. That is shows our shame, embarrassment, and guilt feeling. That is all our body language, which shows our emotion. That is first just how we express our emotions. This is the physical symptom. So this component focuses on enhancing individuals or interpersonal skills, including assertiveness, effective communication, setting boundaries, and problem solving in relationship. And this technique helps individuals build healthier relationship and navigate conflicts more effectively, deal with challenging people, and respect ourselves and others. So emotion has a way of severely and adversely interfering with communication. And being able to communicate with others is extremely important because people cannot read minds or sense emotions that are hidden. So this is our interpersonal effectiveness points. And through this practice worksheet, that is main important skills, that is acronym, that is Dear Man. This is very important. We can use this Dear Man acronym to regulate this, to maintain this relationship effectively. First one is describe. D means describe. Describe the situation objectively. This means sticking to the fact and avoiding the opinion interpretation. Don't interpret it. Just describe it. What is this? What is that? Don't interpret it. Don't judge it. Don't take any opinion. Just describe it. This goal is to get everyone on the same page. Just take a person in that way. जहां पे जैसा हो ऐसा उसको समझना. So do it this way, to think this way. Just describe this situation. What feeling, which feeling situation you feel. Just this way, describe it. Next one, express. That is E. Let others know how a situation makes you feel and clearly express about your feelings. Don't expect that others read your minds. You have to express yourself. You have to say, देखो भाई मैं ऐसा ही सोचूं. I feel because you tell me this way. You behave this way. So I feel so very sad. I feel so happy. So express yourself. This is very important. Next one, assert. Don't beat around the bush. Say what you need to say. आपका behavior ही आपका परिचय है. So behave it assertively. Don't say, like example, well, I don't know if I can cook tonight or not. Better you have to say, I won't be able to cook because I am working late. So just speak assertively. Don't directly hurt anyone. Assertive talking is very much effective to maintain the interpersonal relationship. Next one is reinforce. Dear banners R is reinforce. Reward people who respond well. Give him reinforcement. And why you desired outcome is positive. कभी कभी बच्चे को हम लोग देखता है reinforce कुछ छोटा छोटा रिवॉर्ड देता है to take this behavior again. So reinforcement others, any activities. This can be praise others. This can be as simple as a smile and thank you. Just only say thank you. Only gives a smile feedback. So it is a actually rewards. You can just express your feelings. Just I say just you just give me a feedback. I feel what I am giving the so just give sometimes कभी-कभी थोड़ा सा feedback देना. So give me some smile or just yes I am understanding or this. So this is a to reinforce others. Mindful. Don't forget the objective of the interaction. It can be easy to sidetrack into harmful arguments and lose focus. So don't forget the objective of interaction. You have to focus mindfully. Appear, that is appear confident. You have to appear confident. Consider your postures, your tone, your eye contact, body language, everything appears that you are so confident about dealing with clients. You are a therapist, so you have to confidence about it. So appear, your eye contact, your voice tone have to give a message to that clients, that so that they can depend on you. Negotiable. No one can have everything they want out of an interaction at the time. Be open with negotiation. To say, if you wash the dishes, I will put them away. So negotiate is always, it will be, it continue. Next one is relationship effectiveness. That is give, acronym. What is give? G, give. G means gentle. Don't in attacking movement, attacking talk or attacking way of talking. Don't attack, threaten or express judgment.
Ma'am?
Yes?
Could you please explain negotiation?
Negotiation.
Yes.
Negotiation means negotiate, keep a space of negotiation. If there is arguments in the position in argument, just keep open for negotiation. It is just for the example, one can give you a work, just force you to do this. You just open a negotiation that if I can do it tomorrow, it is helpful for me. Or can I divide this? Can you divide this work with other? It is called negotiation. Okay.
Okay, ma'am. Thank you.
So give means gentle, don't attack, threaten or express judgment during our interaction, accept the occasion no for your request. Occasional no for your request. So don't accuse. If you have any problem to do some work, so just gently tell this, no, I can't do this. This is very, this is how I have a work. So just forgive me. I can't do this. So gentle. Next one, interested. Show interest by listening to the other person. If you do not give show me interest, so I am not motivated, motivated to give you this class. So you have to show your interest. Then other can also motivate it. So give your interest. Is it depends? Is it also helpful to maintain the personal relationship? Validate, be outwardly validating to the others' personal thoughts also. Not only you, just give importance to others' thoughts also, others' feelings. Acknowledge their feelings. Giving, as a psychologist, we have to qualification of empathy. We have to, that's quality. We have to, that's quality, we have to empathy quality. Everyone we should have. So acknowledge their feelings, recognize when your request, if you request every to anyone, it is demanding or not. So respect others' opinion also. And last one is easy. Have an easy attitude. Try to smile and act light at it. Is it also helpful to maintain the interpersonal relationship? Others, last one, that is self-respect. Not only this, you have to self-respect also. So sometimes in relationship you might be find yourself betraying. Have you got? I know I'm not judge myself properly. So I have to import this me also. So this is Dakanus first. This help you to achieve self-respect effectiveness. If you don't respect yourself, so you can't respect others. So first one is fast, that is F, that is fear, or be fair to yourselves. खुद को कभी मत ऐसा कभी खुद को कभी खुद से कभी dishonest नहीं मत हो. So not dishonest yourselves. Apologies. If you have some mistake, you do some mistake, just apologize it. Just accept it. Just express it and take apologize. Yes, I have some mistake. So please forgive me to take apologize. Stick to your values, obviously. Stick always on your values. It is most important of our characters in our character, our values. So stick on your values. Truthful, always be truthful. Don't dishonest with yourselves and others. So always be truthful. This is first. So some other technique also that is common, that is cognitive restructuring, that is similar to CBT, which challenge the maladaptive thoughts, believe that contribute to emotional distress, and reframe the negative thinking patterns and develop balance and adaptive thinking. That is cognitive restructuring. And sometimes skill training, which I give you today, that is skill trainings, and practice the skills by tech training, by education, by guidance. So develop yourself. This new coping strategies in a supportive environment. So all of this are technique of DBT. Now, just 2 minutes, just take a 2-minute break. If you have any questions about technique, we just complete our technique. And this is the stages how we give the treatment. Use this technique through various stages. So far, have you any questions or any feedback? Is it boring? Again, I am telling you, is it boring or interesting? Have you got it fully?
Yeah, ma'am, it is getting when somehow some we get attention.
Please speak louder. I can't hear properly.
Okay, we get the idea, and sometimes we close some attention, but we can come back and we can get an idea about that.
Okay, in what particularly in which skill? In which skill? You can't do this?
Emotion.
Emotion, yes. That is the most important skill. So, it is not easy. All our psychological, that's how I told that all our psychological problems based on these emotions. So we have to regulate, and by practice we have to regulate this. Just maintain the intensity, this level of intensity. Maintain the level of intensity. That's mark the 1 to 10. Give yourselves a number. Is it in between 5 to 6? It is okay, and it is more than 5, 6. So it is alarming. So you have to. We have to, all of us who have to maintain this technique, so this DBT. So that is is it helpful to all of you? Yes, this all this size, all these techniques. Have you got it properly? Have you got it properly? These techniques?
Yes, ma'am.
Okay. So now we are going to the stages. Actually, the stage, there are 4 stages of it. First one is stage 1. That is the beginning stage. It is most serious, most self-destructive, most vulnerable, most aggressive, and all the most this important stage is stage 1. All the suicidal, self-injury, all these vulnerable events, situation can happen in the stage 1. This is first stage. Second is next treatment. Going starting the treatments, moves on to address issue. This affect person's quality of life, such as their interpersonal effectiveness, emotion regulation skill, and ability to tolerate distress. Just moves on from stage 2. In third stage, it is we have to focus on issues, particular issues, the particular reason related to self-esteem and interpersonal relation. What is the core reason of this behavior? Just focus on these issues. Next, last one is, at this point, treatment is focused on helping people get the most out their lives. Others engage others people in the client's life, including finding ways to expressing greater happiness, to find out her interesting skill, her effective skills, or lacking skills, or coping skills, or so just list the engagement activity skills. So greater to find out the greater happiness, strengthen the relationships, and pursue their life goals. So these are the all 4 stages. So first stage, all these 4 stages actually do not specifically be not one by one. So it's before the stage 1, one stage occurs, that is pre-treatment phase, and every client have to go through this phase. When the therapist, that is a stage when we build a rapport with clients. When the therapist can determine that they can work together, they agreed that we will work together. We have to build a client therapist, build a rapport with clients before enter the stage 1. If you agree with work with me, so that I can go with you, we can finding your problems, we can go to give you treatment, right? So first we have to build a rapport before entering stage 1, that is called pre-treatment stage. So stage 1 is the therapist and client when work together to get behavior under control. And in this stage, reducing problem behaviors, life-threatening behaviors, therapy interfering behaviors, and increasing skill-based practice. So the patient will be learning skill in stage 1. That is the starting stage. Okay. So in this case, just see that the problem is here and the it's not balance. Problems, intensity of problems is much more. So next one is stage 2. Actually, this is not a chronological stages, stage 1 and stage 2 and stage 3, stage 4. Sometimes if we finish the stage 1, enter stage 2, but something it can be always relapse. So we have to go back to stage 1 also. So stage 2 involves reducing any trauma-related symptoms, including formal diagnosis of PTSD, stress disorder, and other traumatic emotional. Most important phase, that is PTSD, we covered in stage 2. So therapeutic causing traumatic stress and intensifying emotions. It is essential not to intensity the patient's already difficult emotional experience from stage 1. So in this stage is better than stage 1 when we enter in stage 2, as it is already processes going on. Stage 3 and 4 are not much written in actually DBT stage and psychologist. So it is actually a trusting on self and reaching individual's goals. So where the patience in deeper meaning is a through spiritual existence. So most of work that is done in DBT, that is studied in 1 and 2. 1 and 2, 2 and 1, 1 and 2. So stage 3 is includes living life, trusting the self, reaching individual goals. Normally in stage 2, they started the learning and in stage 3 and 4, the person already absorb or grasping the skills, and they can improve themselves in this stage. And stage 4 is deeper meaning through spiritual. Stage 4 is spiritual existence. So stage 3 and 4 is not clearly mentioned in the manual. So it is depends on individual. So Dr. Marshall Linehan specified these 4 stages. That is, first one is stage 1, that is behavioral stage. That is severe behavioral control, where reducing self-harm, addiction, dissociation rates, suicide attempts, chronic, all those vulnerable symptoms are in stage 1. That is behavioral main problem. Stage 2 mainly starts to overcoming this quite desperation, emotional and cognitive. So it is mainly overcome the trauma, that is emotional regulation stage, mainly fear of this emotion, understanding the triggers. So identify the triggers and overcoming, regulate the emotion, overcoming, that is main stage 2. So and this way they maintain the stage 3, that is problem everyday living. That is problem exist everywhere. So cope it with cope up this technique and balance this with this problem with interpersonal relationship. So mainly when we control our emotion, control regulated emotion, then we can maintain the interpersonal relationship. Rebuilding our life, generalize the skills to relationship and work involved with the life. And we can, our life can start smoothly, go smoothly. In stage 4, that is incompleteness, capacity for joy and freedom. That is just in NASA, that is self-actualization stage, I think. that is sense of self feelings, self dependence, internalized mastery, having perspective, self management, sense of self. This is incompleteness. That is stage 4. All these are 4 stages described by Dr. Marsha Linehan. So, initially developed for the PTC and others mental disorder. So, after this completing this DBT, some positive change can arise as a result of this. Individual notice behavior changes. They should be more able to identify when harmful behavior patterns threaten to occur and should be able to adjust this with healthier ones. Identify this. So, learning the new skill set to deal with any challenging situation in life. Cognitive changes, including the alteration of negative thoughts and beliefs about the self. The acceptance that some situations cannot be controlled but can be responded to in healthy ways. We have to accept this. This problem is everywhere. So, we cannot control others. We have to control ourselves. So, cope up, accept this way. This is the only healthy ways to cope up with problems. Finding new healthy methods of coping with distress through engagement, through activity, through personal likings, through interpersonal relationship, through many the skills, so many skills that we discussed earlier. All these stages, which is favorable, which is acceptable to you. So, do this method to grab this method, which is best for you. Take this and keep on this. So, this is finding new healthy methods. Being able to work collaboratively with others, especially during the group skills training. So, if you work collaboratively, more you have maintained this these problems, maintains the overcome these problems. So, being able to communicate more effectively with others, that is interpersonal effectiveness, resulting in healthier relationship. So, all these are the positive changes which can arise after completing the DBT, learn the DBT skills. But DBT in various settings, that is, it is in group therapy, it is an individual therapy, it is in phone coaching. So, group therapy, what is group therapy? Where patients are taught behavioral skills in a group setting. In group counseling, patients are taught behavioral skills through homework and role playing. Individual therapy means with a trained professional where patients learn behavioral skills are adapted to their personal life challenges, one-to-one. Phone coaching, sometimes patients can call therapists between sessions to receive guidance on coping with a difficult situation they are currently in. So, they can therapists can attend this call and they can give some suggestions to the client. So, DBT must follow 5 basic functions, that is motivating clients, teaching skills, generalizing skills to natural environments, motivating and improving the skills of therapists, and structuring the treatment environment. But it is important that DBT is typically provided by trained mental health professionals and should be tailored to each individual's needs. So, this is the must follow basic functions to give the therapy of DBT. So overall, I just summarize this topics, today's topics, DBT. Just 10 minutes left. That is, before that, just give any feedback, any problems. Just we have only 10 minutes. I have just summarized after that. Just any questions, any feedback, any comments? Say. It is over to you. Hello. Are you? Yeah.
I already mentioned you that, ma'am. This seminar is quite different than rest of the seminars because it shows a deep and practical, even though in a deeper manner. And in this short 3 hours, you able to connect us how we can deal with each cases. So I think when we practice this into our session, it will be more effective, and it will be the outcome for the result, I guess.
Thank you. Any other one? Any questions? Any confusion? Any doubt? Just share. Just share. I'll be happy to know. It's also motivating for me. To others batch also. So let's summarize. Just a recap to refresh your mind. So DBT is a psychotherapy approach that aims to help us to cope with everyday and extraordinary challenges by developing specific skills. DBT was developed by Marshall Linehan, an American psychologist. It was originally designed to treat individuals with borderline personality disorder. DBT focuses on helping people accept the reality of their lives and their behaviors, as well as helping them learn to change their lives, including their unhelpful behaviors. The main DBT skills are mindfulness, interpersonal effectiveness, distress tolerance, and emotional regulation. The skills are mindfulness, distress tolerance, emotional regulation, interpersonal effectiveness, and these tools are acceptance, situation, and these two techniques change your behavior. Through mindfulness, we are aware of the present moment without judgment. So accept the situations. Distress tolerance also managing the crisis without worsening the situation, accepting the reality on it. And we can change our behavior through emotional regulatory emotion, understanding and reducing vulnerability to emotions and changing emotions. And interpersonal effectiveness, also getting needs met, maintaining the relationship, increasing self-respect in relationship. So these two techniques are acceptance, used for acceptance, and these two techniques are change behaviors, adjust behavior according this. So main two goals of DBT. Are we clear about this? Okay. Next, the stages of DBT treatment, that is pre-treatment phase, stage 1, stage 2, stage 3, stage 4. So first one is cooperative working, behavioral stabilization, reduced trauma. Then stage 1, stage 2 explains the reliving our concept, spiritual aspect. Stage 4. Pre-treatment phase, that is pre-stage 1, stage 1, stage 2, stage 3, stage 4. Okay. So what is the benefit? We just divide this 3 stages, that is one rational mind, one emotional mind, in between that is wise mind. So rational mind, what is? Approaches knowledge intellectually, thinks logically and uses past experience, uses facts and research as well as planning focused. Emotional mind क्या कहते हैं? Reason and logical thinking difficult, uses only emotions to make decisions. Reactive tells us how we are really doing, uses core psychologicalness. But wise mind, intuitive thinking, arrangement and balance between rational and emotional mind, live mindfully. So these all the benefit of DBT. So in conclusion, though it has been widely researched and shown to be effective reducing self-destructive behaviors, improving emotional regulation, and enhancing overall functioning and quality of life, various mental challenges, but DBT faces some criticism and limitation. As it is included, DBT actually included a small sample size, focused on specific sector of the mental health population. Not largely it is used. So, critics argue that more research should be done to determine if it is work well or not. So, it is all our today's topic. Thank you to everyone patiently to keep this long hours, 3 hours lecture. We're so thankful to you, and I'm proud of yourself. So all is over. So thank you, and we should think that again. I have another class. I think that is on after 1 month. So let's see you other class also. So it's all over. Thank you. Thank you, everyone. Thank you, Sadia. Thank you, Manju.
Thank you, ma'am.
So now, okay. Now we can, I think, Sadia is not there. So we can leave, I think. And all those, I think all you are present, one can leave. So I think this is not bored, I feel. Right? Okay, please on your video, I just want to see your face. Is it bored face or happy face or relaxing? Just complete it, relax. What are your feelings? What are your feelings? Long tears, class. Okay. Now,
thank you, ma'am.
Good night to everyone. Stay blessed, stay happy. Okay. And ज़्यादा more work and, in our area. So thank you again.
Thank you, ma'am.